Hi, my name is Kelley Anaas, and I've had the privilege of serving the people of Minnesota and its neighbors as an RN for 12 years, the last 6 in intensive care, and the last 8 months in the COVID ICU at Abbott Northwestern Hospital in Minneapolis. I'm speaking to you today coming off a grueling 32-hour work weekend, so if my remarks seem emotionally charged, it's because they are. For nurses, this pandemic has taken an emotional toll. Up until 9 months ago, nurse was my only professional title. Suddenly, I had earned a new designation, frontline worker. Honestly, I've always found this name laughable as it implies that there's a second line of us waiting in the wings. Minnesota, we are your only line. Healthcare workers are showing up in ways that we've never been called to do. And we keep showing up because it's what we do. But there are ways to make this so much better for everyone. I watched this weekend as my ICU filled up with critically ill COVID-19 patients. Suddenly, we were transferring the remaining patients not requiring enhanced airborne isolation to other intensive care units in the hospital to make room for COVID patients flowing in from all corners of the state. Those patients we made space for waited hours for an ambulance or a medical helicopter to take them to us from hospitals in Stacy, Brainerd, Bemidji, everywhere around the state of Minnesota. We intubated more patients than we transferred out to the medical floors, and we said goodbye to patients we've been caring for weeks. Yes, these things have always been part of my job. And yes, to a certain degree, I signed up for the role I'm filling today. But I did that with the trust in my employer, elected officials, and community that I serve would be there to show up and protect me. Nurses have long been one of the most trusted professions in our country, so Minnesota lawmakers, mask wearers, and COVID deniers, I am here today to say that you need to believe nurses when we tell you that these things are happening, and trust that what we are asking for in support so that we can best serve our patients, you and your loved ones. Our hospital beds are not solely occupied by those being vanquished by this virus. People did not stop having strokes, heart attacks, car accidents, and slipping on the ice because a pandemic showed up on our doorstep. And there's no government mandate to make those things stop. My colleagues all over the state are caring for patients infected with this virus at the same time they're caring for patients in the hospital for other reasons. The subject of inadequate PPE may have left the public consciousness in May, but that is still a reality for healthcare workers every day. Nurses are waiting as long as anyone else for the results of their COVID tests, using their own PTO to make up for their missed shifts at work. Our charting modes and electronic medical records are being shifted to crisis charting, which is putting nurses' licenses on the line when it comes to documenting our life-saving work. The person standing behind you in line at the grocery store might be a nurse, a respiratory therapist, a nursing assistant, a physician. You or a loved one might need that person someday soon, and you want to be sure that we can be there for you. Mask up and keep your distance. We need to ensure that there will be a bed and a nurse for patients who need it by halting non-essential surgeries that require an inpatient stay. Given the wide community spread of this virus, we need further limitations on visitors into the hospitals. We need supplies of PPE to be available to hospitals and skilled nursing facilities first. We need increased availability of rapid testing for healthcare staff. If professional athletes can have access to this, then it's possible. It's a matter of reprioritizing our resources. Speaking of priorities, if you have symptoms of this virus or of a known exposure, stay home. Stay home anyway. Keep those that you live with home too. Your ability to sip a beer at a party with friends is not more important than children going to school, than your friend's parent, than your ability to celebrate the holidays with your grandmother next year. Please, Minnesota, stay home this Thanksgiving so that you don't have to ring in the new year with me. Thank you. Michelle.